Toronto Western Hospital. So Epilepsy Monitoring Unit, I introduced Asima, Scott, and myself, Nat. And today we will talk about the Epilepsy Monitoring Unit and how it is set up, what to expect if you're receiving video EEG monitoring, how to get the most of your stay and the treatment at the Epilepsy Monitoring Unit. And so we're going to go through a few slides. At the end of the presentation, you can ask your questions, doubts, clarifications. So it's going to be between Asima and Scott mostly. And so I will ask Asima to take over and start the slide presentation. Asima?
Okay, thank you, Nat. So we'll start off by going through the slide. What is the Epilepsy Monitoring Unit, also known as EMU? So this unit is located on 5B Field at the Toronto Western Hospital. We have 10 beds within this inpatient unit where patients have to spend days overnight while they're being monitored. And we have 3 main room types within our unit. Private room where patients will be in the room by themselves, a semi-private room where they will have a neighbor, so 2 patients within the room, and a standard room with 4 patients. We offer 24 hours of video EEG monitoring using color video camera, microphone, and a state-of-the-art EEG monitoring system.
Okay, next slide.
Thank you. So how did COVID-19 affect our epilepsy monitoring unit? So recently we have reduced our bed capacity from 10 beds to 6 beds. Okay, and patients are required to do a COVID-19 testing on day 1 of their admission. So if our COVID testing results comes back negative the next day, then that's when we will apply the electrodes on the head and start the recordings. But unfortunately, if the COVID-19 results comes back positive, meaning you carry COVID-19, then we will have to send the patient home right away. And currently we have a no visitors policy, so no visitors are allowed at the moment. So how can I be referred to the epilepsy monitoring unit? So you can be referred either through a neurologist at Toronto Western Hospital after a consultation or through your own neurologist in the community. So why might I be referred to the epilepsy monitoring unit? There are several reasons. Okay, first of all is finding out where your seizures are coming from. There might be reasons finding out what type of seizures you are having, to determine whether you are eligible for epilepsy surgery, find a treatment plan for you, monitor your current treatment plan, or to decide if you need more tests. So who is on the EMU healthcare team? It includes our epileptologists, and these are neurologists that are specialized in epilepsy or seizures. We have epilepsy fellow doctors. We have nurse practitioner like me. We have registered nurses, EEG technologists like Nat and Scott, and we have a pharmacist. So in terms of what you need to bring to the unit itself upon your admission, we kindly ask that you bring in your medications, your personal care items, such as your toothbrush, your toothpaste, your hairbrush. We ask that you wear loose-fitting clothing and tops with buttons in the front and no pullover shirts. You may bring in your books, coloring books, games, or arts and crafts. And you may also bring in your phones and laptops. The hospital does offer a free Wi-Fi. So now Scott will take over and give you the overview of an EMU stay.
Yes. So again, my name is Scott, and thank you, Asima, for that introduction. So when you come to the EMU, in a normal scenario, you would see the technologist on the first day, usually sometime in the morning. They will be the ones that set you up and glue your electrodes to your scalp. They would come and speak to you and make sure that you're going to be prepared for that, because it does take quite some time. So they would want to make sure that you're ready and that you have everything you need. After the gluing, you're going to be mostly in your room, trying to be on camera and connected as much as possible. Then on day 6 to 8, depending on the amount of patient flow and the tech availability, we will try and re-glue your electrodes. It also, if the EEG recording quality has decreased significantly, we will try and get your electrodes re-glued a little bit sooner. Your electrodes generally are going to be re-gelled throughout the process in that 6 to 8 days, and they'll be re-glued as necessary, but we're talking about full re-gluing and removal of the electrodes so that you can shower and wash your hair. And then the EMU stay is up to 14 days. The number of days that your EMU stay will last actually depends on several factors, including how many seizures you've had, what it is that you're in the EMU to determine, and a discussion between your epileptologist and yourself as far as whether or not you've gotten enough information to accomplish your goals. Nat, do you want to switch the slide? Perfect. So during your stay, we will record your brain activity 24 hours a day. Even when you disconnect from the computer, your recording continues. So if you leave the room for any reason, the only thing that we would lose in that case would be the EEG, the video. But when you reconnect, everything uploads off the box, as long as you don't disconnect for too long. We will monitor the electrodes and adjust them whenever necessary. And we will review every 24 hours for any seizures, interictal activity, or abnormalities. You will have an event marker and a microphone. And if you experience any auras, events, or sensations during your stay that you feel are related to your epilepsy, you press the little red event marker, and then you speak normally in the room. So you won't necessarily know where the recording device is, but I want you just to face the camera and speak as if you're talking to another person in the room. This makes it so that when we review the information later on, we get a more detailed idea of what it is that you're experiencing. Sometimes people have trouble describing what they're feeling, but anything that you can give will add to the epileptologist's interpretation.
Excellent.
Now, for triggering your seizures, there are several ways that we may enhance your study depending on the advice of the epileptologists. We may do some or none of these things depending on how many seizures you have during your stay and whether you're getting further into your stay and you only have, a little bit of time left. And this includes gradually lowering your seizure medications in a safe and consistent way, asking you to sleep less overnight. This would also include not compensating by sleeping during the day. It's a form of stress that helps to bring out any abnormalities that may exist in your EEG. We could also ask you to hyperventilate. The technologist would come and assist you with this. So they would open your EEG, and it would be very similar if you've had a regular EEG when we did hyperventilation. So they would coach you into how to breathe and how long to breathe, and they'd be monitoring you for any seizure activity during that time. We can also ask you to exercise. Oh, just go back 1 second. Yeah, we can ask you to exercise with a mini pedal exerciser. And we can also do some photic stimulation, where we would show you a range of frequencies that can possibly elicit seizure activity. Okay?
Going good?
Yes. So gluing the electrodes. The process generally takes between 1 and 2.5 hours. The length of time that it takes depends on a number of different factors. If you have very long hair, it will take a little bit longer. If for some reason you don't have significant mobility in your neck, when we have to turn your head side to side, it can create more awkward gluing positions for the technologist. And just to make sure that we are achieving the quality that we desire, it may take up to that 2.5 hours. So don't be worried if you think, you know, it's a short period of time or a long period of time. We'll always get the technical quality that we're looking for. And this process involves the EMU technologist measuring and marking your scalp using the International 1020 EEG measuring system. So what we do is we customize the EEG placements based on landmarks on your head. So we use what's called the Nasian and Inian to measure your head, and then we also measure from the preauricular points on your ears across. We use these 4 positions to determine the percentages that we'll need in order to mark the rest of the electrodes. That way, if you had this test done on a different date somewhere else, or if you came back again for us, we would be able to place the electrodes in exactly or nearly identical positions so that we're measuring the correct part of your brain. After we've done the measurements, we will gently scrub your skin with a new prep gel that's a little bit gritty. This helps to remove the tiny little layer of skin and remove the oil that naturally accumulates on your skin. This helps to give the recording a better quality. After the electrodes are glued with collodion at the marked locations on your scalp, we do this with the air drying technique and little gauze squares that are glued down to your skin. Your hair may or may not be braided or bundled with hair elastics in order to better manage and maintain the electrode integrity.
Excellent. Okay.
Okay, so this is an image of what the prep room stretcher looks like. So what we have on screen is a EMU40 head box with all of the wires leading away from it. We have the white netting, which is a little bit hard to see, but it's on top of the black box there, or the black bag, I should say. And then we have the black netting that also goes over top of the electrodes to protect and bundle them. You can see that there is the neck roll at the back of the bed. You're going to be lying on your neck on your back. This is just to help keep your head in an elevated position so that we can access all areas, including your occipital at the back of your head. And then, of course, there is the bag that holds the electrodes and also has the little red push button that you will be pressing when you have your auras or events. Not visible in this picture, there is also the little hose leading up from the compressed air that will help us dry the glue when we place it on your scalp. All right, Nat. Okay, so here we have a video that we're going to play that shows the measuring in progress. So what you can see is the technologist measuring from Nasian to Inian, and then they are carefully marking percentages based on the patient's scalp size. This patient has a wonderful hairstyle that makes it very easy for us to see all of our markings, and that's why we used it as the example. The gluing process would also be significantly faster for someone with this hairstyle, as it's easy for us to make the electrodes nice and flat. So now they're measuring from the preauricular points across the central line that they had marked. They're making several more marks based on percentages. And there are a few different measuring techniques. This is a seated position used by a lot of the technologists, but there are a few technologists that also like to measure with the patient lying down instead of sitting in a chair like this. There are advantages and disadvantages to each one, but just be aware that neither one is superior or inferior to the other. Now they're measuring the circumference.
So Scott, we can add here, this measuring system covers all the main cortical structures: frontal lobe, temporal lobe, central lobe, parietal lobe, and occipital lobe, right?
Yes. And one of the unique features of the EMU is that we add an extra 6 electrodes to represent the subtemporal structures.
Yes.
So I think now we can move on. Yep. So now this is a little bit further on. The patient is lying in the bed. You can see several electrodes have already been glued to the head. The patient is following the COVID masking protocol. They have their mask on during the procedure, and the technologist also has a mask and a face shield to protect both the patient and the technologist. As you can see, the electrodes are glued on with the gauze squares. What happens is we pour some glue onto the gauze squares, and then we use the air compressor to flatten and dry the gauze. And there you can see the skin preparation where she is scrubbing the skin gently just to exfoliate and create a better contact surface for our electrodes. Did you have anything to add to this slide, Nat?
Not really, no. You're doing excellent.
All right, so I think we can...
So that gives an idea how the gluing is done.
Yes.
And next we can go to the final.
So now you can see the setup has been complete. The patient has the nylon stocking over the electrodes in order to protect and secure everything. Initially, when you experience the setup, the netting may feel quite tight and your skin may feel quite tight as well. So in the drying process, the skin dries out a little bit and feels like it's tightening, but it will loosen over time. And it's important to not pull or stretch the nylon netting because it will naturally loosen as you go through your stay during the week. And I think you can go on to the next slide.
Mm-hmm. Okay. Okay, Scott,
Sorry, can you go to the next slide?
This is, you're not able to see?
No, mine still shows completing the setup.
Okay.
Oh, there we go. Okay, so this is the patient. They have been brought into their room. You can see the computer mounted on the wall to the side. This is where the cable is going to come from that you will connect to your head box in order to keep the information uploading continuously. This is the position that you will typically be in. It's important that at all times, or at least as often as you can, the camera can see your face. So, for example, the chair off to the side, you would not want to have that turned with the back facing the camera. Then if you ended up having a seizure in that position, the physicians that are interpreting it would lose the clinical information of seeing your face and how your body moves during the seizure. You can see that you are allowed to relax with the box off to the side. It's important that you don't feel tension pulling the wires at the back, as they can slip out from underneath the gauze if there's enough tension. The patient also has wrapped around their bed the patient call button. This is for calling the nurses for assistance, and it is separate and distinct from our patient event button. So the one that's in the bag is what you use to denote any auras or seizures, or if you think that something is happening, whereas calling the nurse is a separate issue, and when you press the button, it alerts the technologist that's monitoring in the monitoring room. You don't necessarily hear an alarm or any bells when you press it, but we can always see the EEG as it's running, and we will see a notation on your study that we can later review. Also of note in this room is you can see the yellow corded air gun. So this is a version of what we used to set up the EEG. This is how we are going to fix and re-glue any electrodes that come loose or fall off during your stay in between full re-gluings.
And I can add one more thing. Depending on your seizure types, they might put a soft floor mat, so that way, in case of any fall, we try. Falls do happen rarely, but so the nursing team makes sure there is a padding all over the floor, etc. Those things will be added as the day goes. And
Yeah.
I think, yeah, right?
So when you come into the EMU, they will do a fall risk assessment. And if you are considered a high risk patient, you will get a special bracelet. I don't remember. I think it might be purple colored bracelet. I can't quite recall. But they will also put that mat down that Nat was referring to.
Yeah,
yes, and I also want to add that those paddings, the railings on the side, the bed rails will be padded as well.
Yes. Mm-hmm. And anything else in this? So the washrooms are very close by to the bed. So
Yes.
they can disconnect, or they can keep the cable and go to the washroom, come back. And the cameras are all usually, the camera and the microphone are ceiling mounted. So it's not in this picture, but it is there at the ceiling level. So that way we do keep an pretty decent view of the patient bed and the surrounding.
Okay.
And the next slide.
Next slide. So what will the EEG technologist do during my stay? So every morning, a rotating EEG tech will come to start a new study. This will involve them accessing that computer terminal that we saw in the previous slide. And usually they will either wake you up or approach you when you are already awake in order to fix any loose or broken electrodes. They will do some special testing using the software connected to the computer. And if you pressed your event button over the past 24 hours, the tech may ask you about whether or not it was intentional, what it is that you felt like was happening, or why you pressed the event button. The tech will address any other technical or clinical requirements as needed. Some of these can include broken or damaged cables, troubleshooting the computer, anything really involving the EEG or the equipment as needed. So you don't necessarily have to alert us to that because we're monitoring 24/7. We always try to be proactive with our fixing. And please note that the tech cannot tell you whether any seizures have happened or explain your EEG to you during your stay. Your neurologist will explain the EEG report to you. This is important because we don't want to give any mixed information or incomplete EEG information. Also, the neurologist will be able to place your EEG in the context of your clinical information that they possess. The tech does not necessarily have all of the information available to the physicians.
Yeah. Okay. Next.
Okay, so this is a picture of the central monitoring room. This is a room with a live EEG and video for all 10 beds when we're at full capacity. As mentioned previously, during COVID, we do not run at 10 beds. In this room, the tech or covering registered nurse will monitor you live 24/7 with EEG and video. They will notify the assigned nurse using two-way paging system if any events happen. In addition to this, they can also page to have you reconnect. This is a very common problem because when you're at home or in a different room, you don't normally need to reconnect as soon as you walk into a room. So at least for the first couple of days, usually people forget to reconnect, or it's just not a normal behavior that they've developed. So we will send them gentle reminders to reconnect as needed. And the monitoring tech will also document and communicate any findings to the technologist that is reading the study the next day.
And I think that's pretty much about central monitoring room. That's okay. So the next slide.
So what can I do to get the best EEG recording? So as much as possible, we want you to avoid scratching, pulling, or rubbing the electrodes. Sometimes patients tend to rest their hands on their head or put their hands behind their head when they're sitting or laying in bed. It's best to keep your hands sort of below shoulder level, because any physical touching of the electrodes gives us artifact on the recording, and any touching of the electrodes in general will weaken the glue and the bond that helps keep the recording looking nice. We would like the patients to stay in bed so that clinical events have video recorded as well. We know that this point has limitations. Everyone needs to get up out of bed and move around. We're not telling you to be in there for 24 hours a day, but just that if you are in the room, you stay connected and on video as much as possible. We want you to press the event marker for any auras, events, or sensations that you may have during your stay. This gives us extra clinical information, including whether or not you are aware of your auras as they occur on the EEG, and a little description of what kind of sensations you're experiencing. And we want you to avoid chewing gum or hard candies. You can have your normal snacks and whatever kind of food they bring to you on a daily basis, but when you chew gum, people tend to do it for hours at a time, and it gives us very distinct and broad artifact on the EEG. Same with hard candies. We also would request that you keep extension cords and charge cables away from your bed while devices are charging. We, of course, understand and encourage people to bring their cell phones and their laptops in order to keep themselves busy during this very long stay. But it's best from a technology standpoint to charge your laptop or your cell phone away from you and away from the bed, and then once it's charged, you can use it. Something that I tell to the patients sometimes is, if you're going to be charging your laptop, maybe play on your phone and then switch it up when your phone needs to be charged, that sort of thing. Anything to add, Nat? Okay, next slide. All right, what can I expect when I'm discharged from the EMU, and how do I get my results? So once we have determined that it is safe for you to have your electrodes removed and you're being discharged, the tech will confirm in your chart and with the front desk in order to make sure that it's appropriate to do so. Then they will either take you from your room into the other setup room in order to remove the electrodes, or they could opt to do it at the bedside. The tech will do this by dissolving the glue with a special glue remover. Once the electrodes are removed, you will receive a brochure describing how best to remove any glue that may be left over. We do highly, highly recommend that you shower or wash your hair before leaving the hospital and the EMU. This is so that if you do have any issues with leftover glue, we could apply more remover in order to assist you with that before going home. The neurologist at Toronto Western Hospital or outpatient neurologist in the community will follow up with you afterwards. It can take a little bit of time in order to get all the results compiled, and they may be waiting in order to see what other tests you have had done in order to have a full picture of what's going to happen. And you may also review your results via the My UHN patient portal, which we highly recommend you sign up for if you haven't done so already. Okay, I guess next slide.
One more point here. If you come with a shorter hairstyle, removing glue is very easy. And later maintenance is going to be much easier and faster. The longer the hair with lot of braids, it's going to be a bit of a work to remove the glue completely. It will take few days. So just giving a hint. So if you're planning to come, take a nice haircut, try to keep it short. It helps for the quality of EEG recording as well as for this kind of process.
And you know what, Nat, you reminded me of something else. As you are in the EMU, you have your hair glued down to your head. Typically, you would lose about 100 hairs a day, give or take, on a normal day. But once you have your electrodes removed, all of that hair that you would have lost naturally over the course of the week is going to come out all at once. So you have to be mentally prepared for that, that you may see a little bit more hair in the brush than you're used to. But don't worry, it's not something that's abnormal. It's just a part of how the process works.
Excellent, Scott. Thank you for that point. Yes, people do get freaked out a little bit. I lost all this hair, right? No, the hair naturally falls and it comes back. Yeah. Okay, so the next one, and I think pretty much we are at the end of our slideshow. So thank you all. And any questions for Asima, Scott, and myself, and to Carol, please go ahead.
Yes, I do have the first question I have. Thank you very much for this wonderful presentation. I hope everyone learned quite a lot. Someone is asking, how do you get a private room?
Okay. So when we give patients a call to get them ready to the epilepsy monitoring unit, you can just let our administrative staff know that you would prefer to have a single private room. If you do have insurance coverage, you might want to check with your insurance company to make sure they do cover that cost. Patients may also pay out of pocket if they already have their OHIP. They can check with our admitting office for the latest price list. There is an extra fee associated to the private rooms and the semi-private room if you only have an OHIP coverage.
Thank you, Asima.
Thank you.
Is the audio recorder recording 24/7? That's the next question.
So the camera and audio would record in the room 24/7 along with the video. If you leave your room, obviously there wouldn't be any audio recording because it's not associated with the portable head box that goes around with you.
So I would like to add one more point here. See, the audio video recording is continuously being done, but we cannot check what you're talking for the 24/7. Only thing we are going to look at your video and audio is during the time of your seizure or any questions you have or when you have some communication. That is the time we get the audio played back. Otherwise, your private conversations, your telephonic conversation, you can do as normally as possible. We are not going to be checking on that. It's only during the seizure events we check the audio and visual content for the documentation.
Okay, the next question, what is the food situation if you have food restrictions?
Okay, so when we contact patients for admissions, you can also let us know what restrictions you have. We'll try to accommodate as much as we can. I can contact the patients and just to go through what sort of specific diet that they're currently on. We also have a dietitian aide on site that can come and speak to the patient and modify our diets and what's on the tray to tailor to patients. We also have a pantry with a fridge and microwave that patients may bring food from home as well, but be mindful, we do have a no visitors policy, so you will have to bring enough to last you for 14 days. You may bring snacks to the hospital and keep it at your bedside as well. Okay, that's an alternative.
Thank you, Asima, for that. There's another question. What if patients is, sorry, let me see if I can see that properly. What if patient is on ketogenic diet?
Oh, okay. Oh, ketogenic diet?
I guess it's ketogenic diet.
So unfortunately, the hospital doesn't have
ketogenic
diet, but I do know some patients will prefer to have soya milk. So you may feel free to bring it in. We'll put a name in the label and keep your soya milk in the fridge. But bear in mind, the ketogenic diet oftentimes help to prevent seizures, another way to say it, but we will hope that you will come off or wean off your ketogenic diet while you're here in the monitoring unit so that we can help trigger these episodes. So it may not be a bad idea that we're not able to accommodate the ketogenic diet while you're here. But we also have a dietitian aid if you want to continue the ketogenic diet while you're here. Okay, but we don't have a specific order set for our ketogenic diet within the hospital computer system. I hope that helps to answer your question.
Thank you, Seema. Are there any other questions? Are you not able to shower until the electrodes are removed?
Okay, so you are able to shower. The only thing that you can't do is get the electrodes or the box wet. So in this case, showering would exclude washing your hair. So we do recommend that you maintain your hygiene as best as possible. And you can speak to your nurse on the floor as to the best methods to shower without getting anything damaged or wet. I don't know if someone has something to add about that.
No, I
Yeah, so
think
in terms of the shower itself, there's also electrodes on your chest that we want to keep it dry as well. Your bedside nurse might cover it with a little plastic cover over the electrodes on your chest. And then you can have a shower from anywhere from the neck down and avoid the chest electrode. If there's any concerns for safety while you're in the shower, we might accompany you, okay? And we also offer bed bath if as needed for patients who will prefer to have extra reassurance that they have someone to assist them at all times.
Thank you. The next question, sometimes patients' meds are tapered off. Is it tapered back up gradually before they are discharged or suddenly?
Yes, so it depends on the nature of the patients coming into the monitoring unit, depending on the reasons and purpose. Majority of the patients, after we lower the medications, we will reintroduce the medications back on the same medications that they came in. But that's something that we'll discuss towards the end of this day.
Okay.
Okay.
Thank you. I don't see any other questions. We have a few minutes more. If anyone else has a question that you would like to type in the chat box, and I'll be happy to read it for you. What is the wait time like now? I'm guessing that's to be admitted to the EMU.
Yeah.
Mhm.
We're talking about roughly on average 9 months. If patients are available on short notice, we might be able to expedite a bit. We do have a very strict COVID protocols where we need to meet the criteria, but I would say on average 9 months wait.
9 months. Do people leave their room and stay out of the room for a while? Or
I
are
think
they
my
able?
suggestion here, right? It's people you want to get out from their monitoring, take a walk and come back. We do encourage, but not more than 10 to 15 minutes at a time, because the device which you will be carrying has a capacity of storage of around 10 to 15 minutes at the max. So that is one limiting factor. So we encourage you to stay as much, but we know people like to go out, and we do allow that. And
Okay.
it's not easy to stick around on the bed for 24/7. So there is that possibility. We do allow you to get out of the bed 10-15 minutes, and then depending on the day and depending also on your medications, if its medications are reduced, we encourage you to not to get out of the bed, stay as much as in the room, because you can have a seizure in the corridor walking around. So that safety concern gets into the picture. So it's depending on day to day and the patient, things. So, but it is allowed, isn't it, Scott? We do
Yeah.
allow 15 minutes
And
now.
I would add that if exercise is a concern, if you go back to our evocative maneuvers, we do have the pedal bikes that you can use if you're concerned that you're not getting enough activity or you just feel like you need to move around a little bit as well.
Okay.
Yes, so for patients, especially when their medications are lowered, we encourage them to only walk around within the unit itself just for safety. Okay, but you are more than welcome to walk around within the unit itself, like on the hallway, in the hallway.
Okay, there's another question here. Is the wait time similar to the wait time for an ambulatory EEG?
See, the ambulatory EEGs I can pitch in. Because of the COVID closures, we had to cancel a whole range of ambulatory recordings from last 2020, March of 2020. And then we are getting back and slowly we are ramping up the ambulatory recordings. And for the time being, we have almost next available date is somewhere in August, September.
Okay.
Uh, that is what. But again, sometimes we have cancellations. If you have short notice, if it's okay, we can call you and get an ambulatory EEG done. But this is what is happening now. And also, ambulatories are not like it's done 2 to 3 times a week because the limiting factors of the ambulatory machines and things like that. Yeah.
Okay. If COVID is relaxed by the time that we are able to get in, would we be able to have visitors?
Yes, there's a possibility, but the hospital continuously evaluate the risk. We will have to get advice from the hospital to
Yes.
instruct us in terms of visitors policy.
Okay.
Mhm.
Okay, we have 6 minutes more. Any other questions? Okay, I think
Okay.
we might be over a bit early today. Oh, sorry. Oh, there's another question. Can we have a pillow instead of the neck towel roll?
So I can take this question. The neck roll and towel are only for the setup process. It just helps us to access all areas of your head. Once you're in your room, you don't have to have the neck roll anymore. It's only when we are setting you up, or sometimes they'll bring it in if we have to fix your electrodes at the bedside. But it is strictly a temporary situation to have the neck roll. We understand that it's not the most comfortable situation.
Okay. Thank you so much for this presentation, Nat, Seema, and Scott. It was well received.